we're at an interesting time in medicine, but also in society, where we're using big data as well as machine learning algorithms to try to solve problems in the clinic. We've developed several applications that we're using currently. And so when a patient comes into our clinic, we can place certain parameters that the patient has into our machine learning algorithms that are online, and they can give us real-time data on risks. As an example, if someone comes in for surgery and say they're going to have procedure X and they don't know the risks, we may talk to them about the risks, but actually we can give them very specific risk assessments. And so we might say, well, you have a risk of having an infection of X%, but that's actually tailored specifically for the patients based on all of their parameters. And so we can give them a very personalized risk assessment and also outcomes assessment, which is very different than in the past where it was sort of a cookie cutter approach. Mass General has utilized or has developed a biobank, but also a very large data repository, which includes all the patients that we've cared for here at this institution. So that combination of a very large data repository with computing to back it up, and then clinical questions that are currently unsolved, leads us to trying to use these machine learning algorithms to solve problems. One of the important aspects of the future will be analytics that are in real time. So for instance, patients are not just going to have an interaction when they come into our clinic. They may use an app where we're measuring their outcomes once they leave the clinic. So we'll be collecting data real time at all times. And so we may be asking them questions at different times during their regular activities to really get an idea of how they're doing, as opposed to simply when they're in our clinic and having patient-reported outcomes.